last talk of the day, and thank you for sitting it out. Delighted to be able to present today. I'm going to talk about cancer and what we can do about it through our diet and lifestyle. So I'm going to cover the following points: how diet and lifestyle contributes to cancer development, how we might be able to reduce our risk of cancer, how to improve survival after a cancer diagnosis, and what are the general recommendations for cancer prevention. So just as a means of background, cancer is the top cause of premature death in the UK. That's death before the age of 75 years, and it contributes 42% of these deaths. And 1 in 2 people born after 1960 will develop cancer during their lifetime. And 50% of these cancers are made up of lung, breast, prostate and colon cancer. So I'll use these as examples as we go through. And at best, or at most, our genes that we inherit from our parents contribute 10% or less to all these cancers. But we know that 40% or more are preventable, and this figure is stated over and over by Cancer Research UK and other international organisations. So what are these preventable factors? Well, we all know about tobacco smoking, and that sadly is still the leading cause of cancer in the UK. But second to that is a diet that's unhealthy, low in whole plant foods, fruits and vegetables. Then there's being overweight, excessive alcohol consumption, excessive exposure to the sun, and physical inactivity. So how does this lead to cancer development? Well, there's 3 phases of cancer development: initiation, promotion, and progression. So the first bit, initiation, is happening all the time. Cells in our body are constantly being damaged by exposure to toxins, chemicals, viruses. But our body has a very good way of repairing cells, and if they can't repair them, the cells are discarded and destroyed. But some of these cells will inevitably survive, and whether they survive or not depends on how we look after our body. And the next phase is called promotion. So either these damaged cells will stay small and microscopic and won't expand, or we might feed them or expose them to elements in our lifestyle that leads to the expansion of these abnormal cells, which then become evident as a mass or a tumour or a lump or an abnormality in the blood. And the final stage is progression, where it spreads all over the body, and it's often very difficult to do anything about it at this stage. So what do we know about the impact of diet and lifestyle on cancer development? Well, this study was published very recently. It looked at 2 large cohorts of individuals in the US, the Nurses' Health Study and the Health Professionals Follow-up Study. So over 170,000 men and women followed for decades, and they looked at 5 lifestyle factors: whether people had smoked, whether they were healthy weight, eating a healthy diet, whether they were undertaking physical activity, and whether alcohol was being drunk responsibly. And when we talk about healthy diet, what they looked at was their intake of fruits, vegetables, whole grains, unsaturated fats from plant sources, and omega-3 fatty acids, which we've heard today can either be from fish but can come from plants as well. And unhealthy was classed as red meat, processed meat, sugar-sweetened beverages, trans fat, and salt. And what they were able to show was, with each extra healthy lifestyle factor, at the age of 50, if you had all of these healthy lifestyle factors, men lived 12 years longer and women lived 14 years longer. But what about cancer? Well, if you had the best quality diet full of all those components that I talked about, you could reduce your risk of cancer death, so risk of dying of cancer, by 30%. But if you had all 5 of these healthy lifestyle factors, you could reduce the risk of dying from cancer by 65%. So what does the World Cancer Research Fund recommend for cancer prevention? Well, there are 9 factors. And this wasn't written by a vegan or somebody on a plant-based diet. But the factors they've come up with include a diet that's rich in whole grains, vegetables, fruits and beans. That's what we've been talking about all day, a diet composed of whole plant foods. But in addition, it's essential to be a healthy weight, be physically active, limit the consumption of processed food and sugary sweetened beverages, Limit, I would say avoid red and processed meat. Limit alcohol consumption, because sadly there is no safe limit for alcohol consumption when it comes to cancer prevention. Do not use supplements, and I'll come back to this because this always leads to confusion. If you're a mother, then breastfeed if you can, because there's benefits for you and the baby. And after a diagnosis of cancer, there's probably enough evidence to recommend all these 9 factors to improve your chances of remission and to improve survival. So I've used some cartoons that Doug Brister from our group created, and you can find his fact sheet outside on the table. So I'll just go through each of these 9 points and just describe why we've come to this evidence. So the first point I mentioned was eat a whole food plant-based diet. That's a diet composed of fruits, vegetables, whole grains and beans. And so we've said on our fact sheet that following a predominantly plant-based diet reduces your risk of cancer by at least 18%. And some of this information comes from following large groups of individuals, and there's 2 particular studies that have followed large groups of vegetarians and vegans. So the EPIC Oxford study, based in the UK, but the researchers were in Oxford, and also the Adventist health studies. And we've heard a little bit about the Adventists, who, by nature of their beliefs and their religions, often follow a healthy lifestyle, but also have a large number of vegetarians and vegans. And what these studies have showed us is that, for example, in the EPIC Oxford study, vegans have a 19% lower risk of cancer, and lacto-ovo-vegetarians, so those eating dairy and eggs, have an 11% reduced risk of cancer. In the Adventist health study, vegans have 16% lower risk of cancer, but there's a particular advantage in the vegans for the female-specific cancers such as breast, ovarian and endometrial cancers, and there's a 35% reduction in the risk of prostate cancer. So these are all cancers driven by hormones. And so if you put all this information together and combine all these studies that have been done, overall it does come up with this number of 18% reduction in the risk of cancer if you follow a predominantly plant-based diet. And as a happy side effect, you also have an almost 30% lower risk of developing ischemic heart disease, which remains the top killer of men and women in the UK. So why is a whole food plant-based diet so important? Well, one of the main things we've been hearing all day is that it's rich in fibre. And fibre is key to preventing cancer. And this observation was made back in the 70s by Dennis Burkitt, an Irish missionary who worked in both the UK and in Africa. And in Africa, he was able to observe that those people whose diet was consisting of a minimally processed plant-based diet with very little processed food or animal foods, they virtually never got bowel cancer. They also never got diverticular disease, appendicitis, or other diseases associated with the gut. However, those whose diets had transitioned to more processed food and animal-based foods, therefore low in fibre, had a very high risk of bowel cancer. And studies since then show that we should be trying to aim for an intake of fibre of 40 grams per day, which could halve the rate of cancer of the bowel in the UK. And really, when we look at the diet surveys in the UK, we're barely even reaching 15 grams of fibre a day. So whole grains are part of a whole food plant-based diet, and whole grains are rich in fibre, but they're also full of phytates, which have been shown to have anti-cancer properties, boost the immune system and create a healthy gut microbiome. And the World Cancer Research Fund also says that whole grains probably protect us against colorectal cancer. Beans have also been shown to reduce the risk of cancer, and when you look at the Mediterranean diet in this study, which was the PREDIMED study, it wasn't really looking at cancer, it was looking at heart disease, but what it showed was that bean consumption was also associated with a greatly reduced risk of dying from cancer. And beans are high in fibre, but again the phytates would have been shown to promote immunity and also reduce the proliferation of cancer cells. And we've covered this a little bit, but there's always confusion about the soya bean. It is a healthful bean or legume to have in the diet. There is no doubt about this. And when it comes to cancer prevention, it's been shown to reduce your risk of getting breast cancer, but also reduce the risk of breast cancer coming back after you've been put into remission. And it's especially important to eat soya during adolescence, because this reduces your risk of developing breast cancer later in life. And it's a similar story with prostate cancer. You can reduce your risk of prostate cancer by incorporating soya into the diet. And this is just one example of a study that's looked at the intake of soya milk, and this was in men within the Adventist Health Studies, and they were able to show that the more soya milk that was incorporated into the diet, the lower risk of cancer. So here, if you're having more than 2 portions a day, you lowered your risk by 70%. Difficult to know whether that's because you're substituting out the dairy, but certainly there is good evidence that soya in the diet is healthful and can reduce your risk of cancer. So fruits and vegetables are key to a whole food plant-based diet, and we know from this study back in 2017 that analysed information from 95 different studies, and it showed that there was a stepwise reduction in the chances of developing cancer and dying from cancer with the more fruits and vegetables that you incorporate. And really what we should be aiming for is 9, 10, 11 portions. 5 portions a day, as recommended by Public Health England, is a sort of a middle ground that is meant to be acceptable and people should be aiming for, but more is probably needed. And the particular fruits and vegetables that are full of anti-cancer properties are the red ones, like tomatoes and red peppers that have got lycopene in the red colouring, the cruciferous vegetables with their isothiocyanates that particularly have anti-cancer properties. Berries are probably the most healthful fruit that you can eat with their high levels of antioxidants. And the allium family, so onions, leeks, garlic, that are high in organosulfur compounds. And the other healthful plant-based foods that have been associated with reduced rates of cancer and improved outcomes when you have cancer are the spice turmeric, and it's thought to be the curcumin that's the active agent, but actually even curcumin-free turmeric has anti-cancer properties. So there's probably a whole number of phytonutrients and antioxidants within turmeric that we don't really know about or understand, but is useful to incorporate in the diet. Flax seeds are good for blood pressure and good for the gut microbiome and omega-3, but actually they're a source of lignans, which is a precursor compound of phytoestrogen, which again has anti-cancer properties. And this has been looked at in breast cancer and prostate cancer, and you can reduce the growth of these cancers if you eat plenty of flax seeds. And then nuts again have got anti-cancer properties. Nuts in general are associated with lower risk of chance of dying, of heart disease, but also reduced risk of developing cancer. And we're talking about a handful of nuts a day, maybe 30 grams of whole nuts unsalted every day. So a common question comes up when we're talking about eating plant foods: does it matter if we eat organic or not? And we probably, well, I think from the information that we have, we can say that it is probably best, but we shouldn't avoid fruits and vegetables because we're worrying about pesticides and herbicides, because it's still better to eat plenty of non-organic than to worry about it and not eat enough fruits and vegetables. But the information does suggest that if you concentrate on eating organic foods, you can reduce the risk of cancer. And this study followed nearly 70,000 people in France for about 5 years, and those eating the more organic foods overall had a 25% reduction in getting cancer. And the particular cancers that are benefited are breast cancer and also lymphoma. So lymphoma is something I deal with on a day-to-day basis, which is cancer of the lymphatic system. And it makes sense because the WHO has classified various herbicides and pesticides like glyphosate, diazinon and malathion as probable carcinogens. They're a group 2 carcinogen. And when you look at the cancers that they have said that it might contribute to, it's the lymphomas, and that's what we see in the clinical studies as well. So if you do want to make an effort to eat some organic produce, it might be worth looking at the the Environmental Working Group's list of Dirty Dozen, which is the top fruits and vegetables that have the most pesticides, and the Clean 15, those with the fewest pesticides, and this is updated every year, so you can try and make some helpful choices based on these lists. The World Cancer Research Fund says limit red and processed meat. We would say avoid, because there's no need for these foods in our diet at all. And we've known for a long time that meat in our diet is increasing the rates of cancer. So this was noted by physicians back in 1892 and then later in 1907. The more meat we eat, the higher the risk of cancer. And altogether, this evidence led to the World Health Organization classifying processed and red meats as carcinogens. So processed meats like ham and bacon and salami are known to cause cancer. Red meats probably cause cancer. And we heard in the earlier talk that processed meat causes around 5,500 cases of bowel cancer in the UK every year. That's 13% of all bowel cancers. And if you add red meat to that as well, that brings it up to 20%. So it's a significant risk. But not only bowel cancer, it increases the risk of breast cancer, lung cancer, pancreatic cancer, also nasopharyngeal cancers. And the reason being is that there's toxic substances in this. Predominantly people talk about the nitrites and the nitrates that are added to these processed meats to prevent botulism. And these are converted into the gut to N-nitroso compounds such as nitrosamines, which then damage the DNA and cause the cancers to develop. A similar story with heme iron in that it causes the production of N-nitroso compounds in the gut, which then can lead to damage to the DNA and progression to cancer. When you cook red meat, processed meat, but also poultry, you generate cancer-causing chemicals such as heterocyclic amines and polycyclic aromatic hydrocarbons. So that's another reason why it might be contributing to cancer development. And of course, the more meat you're eating, the less you're eating of the healthful foods, and meats are devoid of fibre, antioxidants, and the phytochemicals that we know prevent cancer. So when you look at the differences between the nutrients in fruits and vegetables and whole grains and legumes compared with meat and poultry, you can see that you're getting all the healthy nutrients, fibre, phytochemicals, antioxidants, prebiotics for the gut bacteria, plant steroids that keep your lipids low in the blood, all from the plant foods, and you're getting virtually none of these from animal products. Another reason why animal foods, particularly the animal protein, is contributing to cancer is because animal protein elevates the level of the growth hormone, insulin-like growth factor. And we know that this is important in contributing to cancer because of the study of this rare group of individuals with a form of dwarfism. It's called Laron syndrome, which has a mutation in the growth hormone receptor such that they have really low levels of insulin-like growth factor, and they virtually never get cancer despite being overweight. They never get cancer. They also never get diabetes. So this hormone is important. And in a regular group of Americans, when they were followed for about 18 years, those that ate the most protein had the highest level of insulin-like growth factor. And if you ate a diet of more than 20% protein from animal products, you had a 4 times increased risk of dying from cancer, and that was associated with this high level of insulin-like growth factor. And we know our diet choices can impact very quickly on our level of insulin-like growth factor. So here you can see the typical Western diet. Here is a low-calorie diet, but a vegan diet or a plant-based diet, you're likely to have the lowest levels of insulin-like growth factor in your blood. And you can change this within a matter of weeks. People have done these studies where people have been put on a whole food plant-based diet, and after 11, 12, 13 days on the diet, their insulin-like growth factor has fallen. So the gut microbiome, which we've been hearing about being important for gut health and mental health and heart health, is also important for cancer development. So if we feed our gut bacteria with fibre, the bacteria produce short-chain fatty acids, which contributes to our bowel health and our immune system and acts to prevent cancers. If you feed the gut bacteria high-protein diets from animal products, these short-chain fatty acids are not formed, and instead you get the production of secondary bile acids, which lead to damage to the cells in the gut and can promote cancer. But what's exciting is that we're realizing that not only can a healthy gut microbiome prevent cancer, that if you do get cancer, your gut microbiome can affect your risk of getting toxic side effects from the conventional treatments that we give as cancer doctors, but also can affect your chances of going into remission or responding to a particular drug. So a healthy gut bacteria and profile of bacteria can improve your chances of responding to the conventional cancer treatments. And just to cover dairy as a source of animal protein as well, this is particularly linked with an increased risk of prostate cancer in men. And I think the associations are fairly strong now because there have been a number of studies showing that there's about a 20 to 30% increased risk of prostate cancer with the most dairy consumption. And 35 grams of dairy protein a day, which is about 100 grams of cheese, can increase your risk of prostate cancer by about 30%. So these are the things within the dairy that are contributing to cancer development. So if you eat or drink cow's dairy, you're going to have higher estrogen levels in the blood compared to somebody who avoids dairy, and estrogen drives female cancers like breast cancer, endometrial cancer, ovarian cancer. Dairy, because it's high in fat, accumulates pesticides because they accumulate higher up the food chain in fat sources, so your exposure to pesticides will be higher. You're exposed to the bovine growth hormone that's resulting in the calf growing very quickly when it drinks this milk, but that causes abnormal growth in our bodies as well. The casein, which is the main protein in the dairy, has been shown certainly in laboratories to accelerate the growth of cancer. Saturated fat maybe in itself isn't driving cancer but contributes significantly to weight gain. And galactose is the sugar that's formed when you break down lactose, and that's been implicating in driving ovarian cancer. And we come back to this IGF-1 hormone, which is high in dairy, and therefore if we drink or eat dairy, it's high in the blood and drives cancer in humans. So I think we're all familiar with the fact that we shouldn't be smoking tobacco. There's no controversy there. I just thought it might be useful to look at the differences in risk between tobacco and meat, because some people are calling, eating meat the new tobacco. And it's sort of correct in that tobacco and processed meat are in the same category of cancer-forming agents. It's a group 1 carcinogen. So the strength of evidence is the same, it's just the risk is different. So if you look at how many cancers that tobacco are causing, it causes 19% of all cancers, and the vast majority of lung cancers are caused by tobacco smoking. However, in comparison, although processed meat can cause bowel cancer, it causes only 21% of bowel cancer when you combine processed and red meats, and overall that's 3% of cancers, although this is probably a conservative estimate because processed meat is contributing to a large number of cancers in addition to bowel cancer. So we've touched upon the requirement or the need to be a healthy weight to maintain health, and obesity is the third commonest cause of cancer now. And Cancer Research UK states that 7 out of 10 of us are now overweight, and probably by 2035, 4 out of 10 of us will be obese. And there is clear evidence that our diet choices impact our weight. So we're back to the Adventists, who you can see, based on their different diet pattern, the plant eaters, the vegans, are the only ones that through life maintain a healthful body mass index, whereas vegetarians, semi-vegetarians and meat eaters all eventually become overweight. And the cancers that develop because of being overweight are certainly breast cancer, bowel cancer, womb cancer, kidney and pancreatic cancer, and there's a number of other cancers that we believe are being contributed to by being overweight. And the reasons being is that it comes back to inflammation. All our chronic diseases now are caused by some sort of inflammation, which is our body's way of dealing with damage or injury. And when you're obese, the fat cells generate more estrogen than the body should have, and this contributes to breast cancer and endometrial cancer. The fat cells produce growth hormones, insulin and insulin-like growth factor, which again cause cells to divide and proliferate. And also the inflammation that's coming by the chemicals and cytokines that are released by macrophages and other cells, also drive cancer. So we'll come on to the sugar-sweetened beverages and fast foods. Now this is often confusing for people as well. I mean, from the information that we have and my interpretation of it, sugar doesn't actually cause cancer, but what it's doing is replacing healthful foods in our diet. It's contributing through the calorie intake to overweight and obesity, and there's good evidence that sugar consumption is contributing to heart disease and in general is an inflammatory food. But what is more clear is that foods that contain sugar, so highly processed foods that's also combined with fat and other chemicals, and what we're calling ultra-processed foods, these are foods that are far removed from their original source. They're highly refined, they've got additives and preservatives, and they use cooking methods that generate carcinogens such as acrylamide. They are the foods that probably are contributing to cancer. And this large study, again from France, showed that with every 10% increase in the amount of ultra-processed foods you're eating, there's a 10% increased risk of cancer overall. And the problem in the UK is that over 50% of what we're putting in our shopping baskets, regardless of whether we're omnivores or vegans, is classed as ultra-processed. So these foods are crowding out all the whole plant foods that should be contributing to our health and well-being. And the problem with these processed foods is not only the cancer, but that they're generating these other chronic diseases. And then the chronic diseases that are defined by inflammation, such as diabetes and heart disease and kidney, are then leading to cancer. So when you look at, this was a study of more than 400,000 Taiwanese people and followed for about 8 years. Those that got cancer, it was shown that 30% or more of their risk of getting cancer was because of the chronic diseases underlying this, plus all the other unhealthy lifestyle factors. And if you didn't have any of these chronic diseases or lifestyle factors, if you were very healthy without chronic disease, you lived 15 years longer than people who are suffering with these chronic diseases. So alcohol, again a bit of an emotive topic, and we've been led to believe that alcohol is healthy for the heart and therefore have a moderate amount, it's good for us. There's a limited amount of truth in that. It's the polyphenols in the grapes that are causing the benefit to heart health. And maybe if you have an unhealthy diet, having a bit of red wine might make it a bit better. But actually for cancer prevention, there is no safe limit. 1 drink a day of alcohol increases your risk of breast cancer by about 8%. And there are 7 different types of cancer that are directly caused by consumption of alcohol. The alcohol adversely affects your gut microbiome. The alcohol forms acetaldehyde, which is a known carcinogen, and again, alcohol is a group 1 carcinogen, and it generates inflammation in the body. So what are the healthful drinks that we should be taking in instead? Well, the 2 ones to mention that are particularly good for cancer prevention are coffee, which is full of polyphenols and is thought to prevent liver cancer and endometrial cancer, and tea. And green tea is probably the one with the best level of evidence. Those that drink the most green tea also probably have other healthful lifestyle factors, but also have a reduced risk of cancer. And green tea has been shown to be good for gut health, reducing the number of polyps that develop, good for precancerous oral lesions, and also there's some evidence in its use in chronic lymphocytic leukemia, where it seems to reduce the progression of this chronic leukemia. And this is too detailed, but just to show that all these foods and drinks that we're taking in can act in a beneficial way to all the 3 stages of cancer that I mentioned. It can prevent initiation, the promotion, and the progression of cancers. So to cover the issue of supplements, every time I write this on Facebook, don't take supplements to prevent cancer, there's always people who say, but what about this supplement, what about this supplement? Basically, the data show that taking above the nutritional level of a supplement, so taking more than you need of vitamin E or selenium or vitamin C, does nothing to prevent cancer. You need to be getting all your nutrients from a healthful diet. And in fact, studies that have been done with higher levels of supplements of certain vitamins such as vitamin E and selenium actually have shown harm. I did my PhD on selenium, and during that time a large study reported that was trying to prevent prostate cancer in men, and they gave these men selenium and vitamin E, and the final results showed that those taking vitamin E actually had an increased risk of prostate cancer, and those taking selenium supplements actually had an increased risk of diabetes. So you can't take the individual nutrient out and hope that it will prevent cancer. You need to get it from the whole food. But we've also talked about what supplements may be needed if you're eating a completely vegan or plant-based diet. B12 is a must. B12 is probably a must for all individuals over the age of 50 because our absorption reduces regardless of our diet pattern. Iron and folic acid may be required for those who are planning a pregnancy and who are trying to get pregnant, and that's certainly true for folic acid. And vitamin D is recommended for all of us in the winter months by Public Health England, and for infants and young children as well. But you need to get the required amount. Taking more is not going to prevent cancer. So be physically active. This is hugely important, probably just as important as diet when it comes to remaining healthy and preventing cancer. And regular exercise reduces the risk of about 13 cancers, and it comes down to reducing inflammation. It maintains a healthy weight. It reduces the level of the hormones that we've been talking about, insulin-like growth factor and estrogen, but it also reduces insulin resistance. It reduces inflammation by boosting the immune system, and exercise after a diagnosis of cancer can help prevent recurrence. And just briefly to touch about breastfeeding, this has also been shown to be a healthy lifestyle factor for the baby and for mums. So the benefits for mum are that breastfeeding can reduce the risk of cancer and reduce the risk of type 2 diabetes later in life. And when I'm talking about the recommendations for breastfeeding, the recommendations are to exclusively breastfeed for the first 6 months of life, and then to continue breastfeeding up until 2 years ideally. And we're far away from that in the UK, because there are benefits for the child as well. It reduces overweight and obesity later in life, there's better immune system and reduced risk of infection, and reduced risks of asthma and type 2 diabetes. So what is the evidence to suggest that these lifestyle changes can improve your risks of surviving a diagnosis of cancer? Well, there's the classic example from Dr. Dean Ornish. He's the pioneer of lifestyle medicine, and he has used his whole food plant-based diet, low in fat, alongside regular exercise and stress-relieving activities in men with prostate cancer. So 93 people with early-stage prostate cancer were randomized to his lifestyle intervention versus a control group that didn't change their lifestyle. And after a year, he was able to show that in the group that changed their lifestyle, there was a reduction in the prostate-specific antigen level. That's the marker of the growth of the prostate cancer. But in the control group, this marker of cancer growth went up. Now, I appreciate these numbers are small, yet they are statistically significant. But when we look at the hard outcomes, after 2 years, 27% of the control group went on to have conventional treatments, that was radiation and surgery, versus only 5% in the lifestyle group. And what they did was take the blood of the people on the lifestyle intervention, and before the intervention, they put the blood over the prostate cancer cells in the laboratory, and they were able to show that the blood from the patients were able to inhibit the growth of cancer by about 9%. So there was some inhibition. But after the lifestyle intervention, after a year, the blood from these individuals resulted in a 70% reduction in the growth of the prostate cancer cells in the laboratory. And similar studies have been done in women with breast cancer. So this study showed that a low-fat diet that emphasized whole grains and fruits and vegetables resulted in a better survival in people who developed breast cancer. And then very recently, a study has shown that the quality of the diet before and after a diagnosis of colon cancer can improve your chances of staying in remission and also for living longer. And the conclusion of this study was that dietary patterns with high intakes of plant food and low animal food before and after a diagnosis of colorectal cancer are associated with longer survival. So Doug has put together a fact sheet that you can download from our website. This is just a snapshot, but there's a larger version going through all of these things that I've talked about. So I hope I've covered in this short time how a large proportion of cancers are preventable and that diet and lifestyle are contributing to our high cancer rates, but we can take personal responsibility and try and reduce our risk, and that plant-based diets and other lifestyle factors such as exercise and avoiding smoking and alcohol can reduce the risk of getting cancer, but can also improve your chances of surviving a diagnosis of cancer. Thank you.